And we are live. Welcome to the Health and Government Operations voting session on vote list number 8. I'm tangled in my cords, excuse me. And I guess you can hear me, but you can't see me. All good now?
We can do both.
Okay, excellent. With that, we're going to start with House Bill 6, Aaron and Delegate Penny-Melnick.
House Bill 6, as amended, would provide that beginning on January 1st, 2023, the Maryland Medicaid program would be required to provide dental services for adults, including diagnostic, preventative, restorative, and periodontal services. And those would be provided to adults whose annual household income is at or below 133% of the federal poverty level.
Delegate Penny-Melnick.
Again, thank you, Madam Chairman. We had a discussion in subcommittee. The vote was unanimous. This has been amended, so it's not comprehensive. It will be offering diagnostic, preventive, restorative, and periodontal services. And it's for, people that are very poor on Medicaid, so they can take care of their oral health, which oftentimes leads to very serious illnesses. The fiscal note has been reduced dramatically, and I move the amendments.
Second.
Is there discussion on the amendments? All those in favor say aye. All those opposed, no. Please raise your hand in the panel that I'm about to open up. I see no hands. The amendment passes unanimously.
I move the bill, Madam Chairman.
Any discussion? All those in favor say aye. All those opposed, no. Please raise your hand in the panel. Seeing no hands, the bill passes unanimously.
Are we voting
Yes.
on the bill or the amendment? I'm sorry.
We're
Is this
voting on the bill.
Okay.
This is the bill. Now, I'm going to say this. I usually forget this, but we've waited so long for this, and this is so good to finally be able to do it. How many people would like to be amended on? How many people would not like to be amended on as a sponsor to this bill? Is there anyone who does not want to sponsor this bill? Great work, Delegate Saab, Delegate Riley, Delegate Kipke.
Madam Chairman, I think I missed the vote. I want to vote no on this bill.
Delegate Saab, we will correct our vote and mark you as no on this bill. Delegate Riley. You're muted, Delegate Riley.
Yeah, I just do not want to be a co-sponsor.
Okay, Delegate Riley will vote yes, but will not be a co-sponsor. Delegate Kipke, your hand is down. Could you please make sure I know what to do with your vote and your sponsorship?
Yes, I'm voting for the bill because I think it serves as a deterrent to employment if you don't have proper oral health.
Yeah.
And I like people working. But because I don't like expanded
Voting?
government, I don't want to be a
Voting session.
co-sponsor of the bill. I have some mixed feelings about it, but I do think for the poorest of the poor, we need to do what we can to keep them working. Thank you.
Thank you. Have you got that, Richard? Richard?
Was that a no for Delegate Kipke?
It was a no sponsor, yes bill.
Oh, yes, got it.
Okay, no sponsor for him, but yes on the bill, and the same, I believe, with Delegate Riley. But Delegate Saab was a no and a no. Correct, Delegate Saab? I don't want to get anything wrong because this is important.
Yes, correct.
Thank you. Okay, House Bill 178. Aaron, Delegate Penny-Melnick.
House Bill 178, as introduced, increased the maximum annual revenues from the sale of cottage food products that a cottage food business may have from $25,000 to $100,000. There's an amendment that was adopted in the Public Health and Minority Health Disparities Subcommittee that reduced the $100,000 cap to $50,000.
Delegate Penny-Melnick.
This is a great a great little bill that will help, people in the cottage food industry. And this was a compromise, and the vote was unanimous, and I move the amendment.
Second.
Any discussion on the amendment? All those in favor say aye. All those opposed, no. Put your hand up in the panel, please. I see no no's. The amendment passes unanimously.
Chairman, may I ask, I would love to sponsor this bill.
We're not done voting
Oh,
on the
I'm
bill.
sorry.
Would you like to move the bill first?
Yes, I got it ahead of myself. I apologize.
It's
Yes.
okay. I do it all the time. It's nice that it's
Okay.
not me this time. The bill has been moved. Is there a second?
Second.
Any discussion? All those in favor say aye. All those opposed, no. Please raise your hand in the panel. I see no hands in the panel. The bill passes unanimously. It is amended. Would anyone like to not be a co-sponsor? Can I see the no, I don't want to co-sponsor this bill by raising your hand? The whole committee, those present, will be added as co-sponsors. Excellent. Thank you. House Bill 47. Wait a minute.
All right, that was just a reminder text.
Oh,
to me.
I need to turn off my noise here. I apologize for the noise that went out to the world there. Okay, it won't make so much noise next time. House Bill 479. Lindsay and Delegate Rosenberg.
This bill requires the governor to annually proclaim the fourth Thursday in March as Tuskegee Airmen Commemoration Day. The proclamation must urge educational and cultural organizations to observe Tuskegee Airmen Commemoration Day through appropriate and informative programs and activities. And there are no amendments. It was considered in government operations.
Delegate Rosenberg. You may be muted, Delegate Rosenberg, or you're not speaking, one or the other. You're still muted, Delegate Rosenberg. Delegate Rosenberg. Earth
this.
to Delegate Rosenberg.
Try the space bar. That works for me.
I'm okay now. Sorry.
Okay, start again.
Okay. I think we're all familiar with the Tuskegee Airmen who fought in flew in World War II, despite the Army being segregated still. And so this was unanimous in committee. And the Senate bill has passed second reader and is identical. No substantive amendments, just sponsor amendments on the Senate side. So move favorable.
Second.
Any discussion on the bill? All those in favor say aye. All those opposed, no. Please raise your hand in the panel. I see no hands in the panel. The bill passes unanimously, and there's no amendment on here, so we're not doing a sponsor amendment. Okay, House Bill 484. Lindsay.
This bill requires the governor to annually proclaim October 5th as Dasein Day, a festival originating in Nepal that celebrates and symbolizes victory of good over evil. There are no amendments on this bill, and it was considered in Government Operations Subcommittee.
Delegate Rosenberg.
Thank you, Madam Chair. This was unanimous in the subcommittee. As Council has pointed out, this originated in Nepal, but is now celebrated in several South Asian countries to mark the triumph of good over evil, and would move favorable.
Second.
Is there discussion on this bill? I see Delegate Chisholm's hand is raised.
Thank you, Madam Chair. And I did vote this favorable in subcommittee. I'm probably not going to vote for it in full committee, just in a move of solidarity with my good friend Delegate Saab, who is waiting for his own holiday.
Delegate Saab.
So this, I'm going to vote against this bill, and has nothing to do with all due respect to Delegate Bhandari. I just think we're setting a precedent that, we're picking certain cultures over other cultures. And for that reason, I'm going to be a no vote on this.
Okay, Delegate Shaleka.
Before I was on this committee, I know my good friend and office mate, Delegate Sue Ullman, had a German-American commemoration day she brought every year for like 10 years. Did we ever give her that commemoration day?
I'm not sure, Bill, she was sponsoring particularly, but there is German American Heritage Month.
Okay, thank you.
Madam Chair,
Delegate Rosenberg.
I would just add, I think this is a positive affirmation of a culture. It's not one over another. And we do this sparingly on this committee, but we have done similar days, commemoration days before, and therefore I'm proud to urge a yes vote.
Delegate Chisholm, are you going to have a second bite at the apple, or did your hand just not come down?
No, a second bite, Madam Chair, and I agree with Delegate Rosenberg, and I agree with good over evil, obviously, and I have no problem with the bill. It's just, once again, in solidarity with Delegate Saab, who feels left out at this point. I'm going to stay with him.
The misguided leading the other.
Maybe.
Okay, we
Madam-
love you anyway.
Well,
All
thank
those
you.
in favor, Delegate Kelly, did you have your hand raised to say something? You're muted.
Briefly, just in solidarity with my good friend Delegate Bandari, I will point out that my daughter's best friend is from Nepal, and she has so much pride in Delegate Bandari's service, and I'm super excited to vote for this bill.
Okay. All those in favor, I believe we heard a moved in a second, did we?
Yes.
So moved.
Okay, is there a second just to make sure we did it
Second.
right? Thank you. All those in favor say aye, and all those opposed,
Aye.
no. All two of you, please raise your hand in the panel. Oh, more than two of you. Okay, I see Delegate Chisholm, Delegate Riley, and Delegate Saab voting no, and that's all I see. Okay, this bill passes -3. House Bill 516, Lindsay.
This bill requires the St. Mary's County Human Relations Commission, in addition to its existing duties, to encourage and ensure equal treatment of all people without regard to sexual orientation or gender identity, and with respect to discrimination in education. The bill also replaces statutory language referring to racial tensions with language referring to tensions within the community. There are no amendments on this bill. It was considered in Government Operations Subcommittee, and we do have a delegation letter from St. Mary's County delegation in support of the bill.
Delegate Rosenberg.
Yes, this was unanimous vote, and this bill broadens civil rights protections in the mother county. So I would urge a favorable.
Would you like to move the bill?
Move a favorable instead of urge.
Is there a
Thank you.
second?
Second.
Is there any discussion of this local bill? I love it when I read these notes that pop up on my screen. I have no idea why that note pops up. Do you guys see that note?
Yes.
Oh, good. It's very distracting. Okay. So all those in favor say aye. All those opposed, no. Please raise your hand in the panel. I see no hands. House Bill 516 passes unanimously. House Bill 609, Aaron.
House Bill 609 repeals the provision that specifies that a health officer for a county serves at the pleasure of the governing body of that county and the Secretary of Health, and instead enumerates specified reasons for which a health officer may be removed from office with the concurrence of the governing body of the appropriate county and the secretary. The bill requires the secretary to provide written notification of removal to a health officer and authorizes a health officer to appeal a removal decision to the secretary in the Office of Administrative Hearings. There is an amendment that was adopted in the Public Health and Minority Health Disparities Subcommittee that was supplied in a separate email to you all. This amendment clarifies, for purposes of the state personnel and pensions article, that a local health officer does not serve at the pleasure of their appointing authority. This bill was considered in the last voting session and was held.
Delegate Peña-Melnick.
Thank you so much. I want to thank Delegate Sipsap for a good discussion. We discussed this bill in subcommittee. The vote was not unanimous. It was party lined. I want to add to what Aaron said, the importance of this bill. The 23 county health officers are all state merit employees under the Maryland Department of Health. And their direct supervisor is a deputy secretary of public health. So ultimately they answer to the secretary of health and the governor. Once hired, there's no need or process for reapproval by elected officials since they're all state employees. I want to add that the focus of this bill and why this is so important, and I'm sure you have read about it, you have seen it, is the pressure that these health officers have been under for the last 2 years. And this bill is important to take the politics out of public health and make sure that these decisions are based on science to give them some protection. I move the amendment.
second,
Is there a discussion of the amendment? I see Delegate Shalega's hand is up.
I'm sorry, can you review for me what this amended bill will do?
Delegate Peña-Melnick or Lindsay,
I was
Aaron.
looking for my bill packet and I
Yeah,
couldn't find it.
Aaron, go ahead, Aaron.
You're looking for the bill or you're looking for the amendment?
What will the amended bill do?
So it's almost the same as it was introduced. So it repeals so in current law, a health officer for a county serves at the pleasure of the governing body of the county and the Secretary of Health. This bill would require that for removal, it would have to be for specified reasons. And it lists those reasons as immorality, misconduct in office, insubordination, incompetency, and willful neglect of duty. And then it also adds a sort of appeal process and hearing process. If a health officer is removed, they're able to have hearing rates, and I can spell those out that are in the bill, but right now there's no hearing rates or notification as to why a health officer was removed. And then the amendment just clarifies, it goes into the state personnel and pensions article, and it clarifies that health officers do not serve at the pleasure of their appointing authority. So it kind of goes along with the tenets of the bill.
So just for a little background, the Dr. Bashai from Harford County, who came and testified a number of times in front of our committee. I have spoken to people in Harford County, and I've asked vociferously for them to actually meet with Chair Pendergrass and Vice Chair Peña-Melnick separately to talk about the case, and they're forbidden from doing that because it's a personnel matter. But I would say, that it potentially was not rightly represented in the committee. And I think that these health officers should be accountable. They have so much power, and if they need to be removed, I think it's reasonable to have a removal provision that's stronger than what we're doing here in my experience with what's gone on. Thank you.
Thank you, Delegate Shalega. Is there anyone else? Did you want to say anything, Delegate Peña-Melnick, or just leave it at that?
I would just say that the bill in front of you, and this bill was not put in for this particular health officer. This is just, it's everywhere. All the health officers in the state have just felt an enormous amount of pressure dealing with COVID on top of it. The bill as amended includes that a person can be removed for immorality, misconduct in office, insubordination, right? Incompetency or willful neglect of duty. So I think that if a health officer is not doing what they're not supposed to do, no matter the power that they have, they won't be able to stay in office because the reasons here are very clear. I'll just leave it at that, Chairman.
Okay, I'm going to say that we're going to change that word incompetency to incompetence, which is, I consider, a technical amendment to make it sound like it's proper English, which incompetency sounds odd to me. Unless anybody objects to my technical amendment.
Sounds good to me.
Delegate Saab.
Thank you, Madam Chairman. So obviously, you're aware of my discomfort with this bill because I think it's just a knee-jerk reaction to some of the political stuff that happened throughout COVID with some of the health officers. And some of the issues that I still see in the bill is that the definition of immorality is very broad. What's moral to someone may not be moral to other people. So I think it's going to be almost nearly impossible to remove a health officer, and it's making them as strong as Supreme Court justices. Immorality, insubordination can be explained many different ways. Incompetency. So I think just sets a bad. It's just bad policy, in my opinion. And I, was hoping that we can strengthen the language, at least to give some of the flexibility to the leadership, the executive leadership, or the commissioners in certain counties to decide who that person is, because they don't only decide on health stuff. They deal with restaurants and they deal with a lot of things. So they have a huge, big responsibility, and I think that person is making decision that affects people's livelihood. And at the end of the day, they're not elected, and now we just reinforced their position. And, for that reason, I'm definitely, I'm not voting for this bill because I just think it's the wrong time. And I hope, some of you would reconsider this bill because it's just probably one of the worst things that we got out of our committee. And I don't like to say that because I strongly feel about this bill. But, there are some common sense amendments I think we could have reached, but unfortunately, the way the bill stands now, I can't support it.
Okay.
But thank you for listening to me in subcommittee and other discussions that we've had. And I appreciate the time.
And I appreciate the discussion that we've had because of your concerns. I really do. Sometimes we philosophically disagree on things, but we accept other people's philosophies about these things. I'm going to give my little speech about this because I've been thinking about it. And, COVID has been traumatic for everyone. That I don't think anybody has escaped that. And sometimes during this pandemic, I've thought about how fortunate that I've been where I live, that I've been able to be safe, that I have a person who I love who is with me, takes me for walks to make sure I am healthy. And I think about the nurses and the doctors, and frankly, the public health officers and the jobs that they do. And I've thought to myself, had I been a physician, a nurse's aide, would I have gone to work? I quit a job years ago because a kindergartner, it was a substitute teaching job because a kindergartner brought a gun to school. And that was in 1975. And I said, my life is worth more than that. So I guess in a way, I'm trying to say that I see these health officers as healthcare heroes, along with all of the other healthcare providers that have been helping us deal and get through this crisis that we've been through with the pandemic. And for that reason, I feel very strongly that these health officers do need the protection of the merit positions that they do have. They're not at the pleasure of appointees. They are merit employees. And I think that we need to support them in this way. So that's my 2 cents in this discussion. Is there anyone else who has something to add? With that, then did we move the bill, Delegate Penny?
Delegate Chisholm has his hand up, Madam Chair.
Oh, Delegate Chisholm, I'm sorry, I missed it.
Thank you, Madam Chair. And I just want to make the point that, I know Delegate Saab and I and others, we also heard from a lot of healthcare professionals that felt like they were at odds often with health officers. And obviously we hear from a different variety of people sometimes that felt like their rights were being trampled on and nobody was listening to them. And oftentimes they felt like they were answering to somebody that was not accountable to the public interest or weren't accountable to what was going on in their own life. And I think that's where people like myself and Delegate Saab feel like, well, they might be the minority voice, but they need to be heard as well. And I think that's my biggest concern with bills like this is nobody should ever be put into a position. And we had it here in Anne Arundel County where I got put in the middle of a court case because the health officer usurped a lot of different rights, and that scared a lot of first responders. It scared a lot of medical professionals, and it scared a lot of citizens. And I think we need to be careful. We need to be measured whenever we give somebody this, I guess, authority to impress their own will. I know they're doing their best. I know that nobody is acting in a way that they feel like they're doing the public a negative, but we have to be careful whenever we pass a bill like this.
Thank you, Delegate Chisholm.
Thank you, Madam Chair.
And I do respect the other opinion. We don't all have to agree on things. Delegate Hill.
Thank you, Madam Chair. Even before the pandemic, we were having issues with politics entering the field of public health. And I appreciate the fact that, particularly in the time of a pandemic, I don't care if it's COVID or it's meningitis or it's Ebola, they're the people that have to say no to everything that we want to do. And it's not an enviable position. And as merit employees, I don't think that they should come under political pressure because we who are elected are frankly more interested in satisfying the people who vote for us, the people who are in our neighborhoods and see us on a regular basis and our friends. They're the people who have to say no to their mothers and their fathers and their friends in order to protect the rest of us against our best judgment. And so for that reason, I think that having health officers who will take the information and make their best judgment should not be a detriment to their continuing their jobs.
Thank you, Delegate Hill. I'm not sure that the bill was moved and seconded. I've been sort of focused on the discussion, frankly.
If I may, Chairman, I move the amendments and I'll move the amendment with your correction of the wording as well. And so if we could.
Is there a second?
Yep.
Second.
All those in favor, please say aye. All those opposed, please raise your hand in the panel so we can make sure we get you in the right column. Those voting no are Delegates Kipke, Delegate Chisholm, Delegate Riley, Delegate Morgan, Delegate Saab, and Delegate Shalega.
On the bill as amended, I move the bill.
Is there a second?
Second.
Is there discussion on the bill as amended? All those in favor, please say aye. All those opposed, please make sure your hands are raised in the panel. I see Delegate Kipke, Delegate Chisholm, Delegate Riley, Delegate Morgan, Delegate Saab, Delegate Shalega. Did I miss anyone? Okay, you'll all be reported as no.
Thank you so much for a good discussion.
Yes, thank you. And the bill passes. House Bill 612, Lindsay?
This bill requires the Governor's Office of the Deaf and Hard of Hearing to maintain an estimate of the number of deaf and hard of hearing individuals in the state and include the current estimate in the annual report they submit to the Governor and General Assembly. The office must also identify and facilitate opportunities for underinsured individuals to gain equal and affordable access to hearing aids. There are no amendments on this bill. It was considered in Government Operations Subcommittee.
Delegate
Madam Chair.
Rosenberg.
Thank you, Madam Chair. like other bills that we have enacted over the last two sessions, this provides equity so that all people who have this disability can seek opportunities to gain equal and affordable access to hearing aids. This was unanimous, and I would move favorable.
Is there a second?
Second.
Any discussion? All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. And we will now move on to House Bill 625. Lisa.
This bill establishes the commission to study the healthcare workforce crisis in Maryland. The Secretary of Health must designate the chair of the commission. The state agencies represented on the commission must jointly provide staff for the commission. There are amendments that add the Secretary of Labor, Deputy Secretary of Behavioral Health, and the Executive Director of the Maryland Longitudinal Data System Center to the commission. They require the commission to establish advisory committees or stakeholder work groups and specifies membership of the advisory committees and stakeholder work groups. Adds to the list of settings for which the commission will determine if there is a shortage, requires the commission to specifically study wage increases as a strategy to reduce turnover, requires the commission to consult with the Department of Veterans Affairs to examine methods for improving the transition from military to civilian life, and requires the commission to study barriers to licensure for foreign-born health professionals.
Delegate Kelly.
With the amendments, the bill passed unanimously in the subcommittee. I move the amendments.
Is there a second?
Second.
Is there a discussion of the amendments? All those in favor say aye. All those opposed, no. Please raise your hand. The amendment passes unanimously.
The bill is
Delegate-
amended.
Is there a second? Any discussion of the bill as amended? All those in favor say aye. All those opposed, no. Raise your hand in the panel. Seeing none, the bill passes unanimously. Next, we'll move to Delegate House Bill 663. Lindsay.
This bill increases the maximum fees for an original notarial act and performance of a remote notarial act, repeals an exception to remote notarization provisions that applied to wills and trust instruments, clarifies the application of specified requirements for credential analysis and identity proofing as they pertain to remote notarial acts, establishes requirements and procedures for remote notarial acts involving a tangible record, specifies procedures by which a notary public may administer an oath or affirmation to a remotely located individual, authorizes the Secretary of State to adopt regulations prescribing the methods for reasonable confirmation of a tangible record, and makes clarifying changes to communication technology requirements applicable to remote notarizations. Finally, the bill specifies that notarization of a document under the requirements of executive orders authorizing remote notarizations must be deemed valid if the notarization occurred during the time that the orders were in effect. This bill does not have any amendments. It was considered in Government Operations Subcommittee.
Delegate Rosenberg.
Thank you, Madam Chair. Just to be clear, this authorizes an increase in the fee up from which it is currently, up to as high as 25. There was testimony that the cost currently is often greater than $4. So there is a need, since we are asking businesses or individuals to provide this service, to increase the fee for that reason. And the fee can be waived in certain circumstances. This was unanimous, favorable. Move favorable.
That's favorable on an unamended bill, correct?
Correct.
I heard a second. Is there any discussion of the bill? All those in favor say aye. All those opposed, raise your hands, please. I see no hands. The bill passes unanimously.
Madam Chair,
Yes, ma'am.
on the previous bill, the health officers bill, could I be a co-sponsor? I think there was an amendment. Just it was a department bill or.
I'm looking. The Commission to Study Healthcare Workforce.
No, the one about.
House Bill 609.
House Bill 609, local health officers.
Yes, ma'am.
I don't even know who's speaking. Is that Delegate Hill?
Yes, it is.
Okay, that's fine. It's kind of out of order here, but we'll do it
Thank you.
because actually probably easier than going back to it later. Is there anybody else who wants to be a co-sponsor of that bill while we're doing it?
Yes.
Okay, Delegate Lewis, anybody else?
Delegate Bandari.
Delegate Bandari and Delegate Kerr? Anyone else?
Delegate Landis.
Delegate Landis. Have you got that, staff, Richard?
And Delegate Carr.
And Delegate Carr? Richard or Susanna?
It's me,
Oh, Aaron, have you got it? Or do I?
Yeah,
need-
Carr, Landis, Kerr, Robin Lewis, Hill, Bandari.
Okay, everybody happy? Okay. Thank you, Delegate Hill. Let's see if we can't try to remember, and it's me too, to offer that for bills, but we'll just keep going. I think we noted that House Bill 663 passed unanimously, and we will now move to House Bill 775. And that is Aaron and Delegate Penny Milnick. They've been very busy today.
House Bill 775 establishes the Maryland Pediatric Cancer Fund checkoff on the individual income tax return form. After the comptroller deducts administrative expenses, the contributions are credited to the fund and distributed by the Maryland Department of Health. There are no amendments.
Delegate Penny Milnick.
Yes, we had a discussion on this bill and I believe it was unanimous. Am I right?
Correct.
Yes, it was. Yeah, it was a unanimous vote. There are no amendments. And the fiscal note is very low, less than 100%, $100,000. It's first $58,000 to add the check off to personal income tax form by the controller's office. And then after that, it levels to about close to $30,000. So I move the bill.
Second.
Is there any discussion on this House bill? Seeing no hands. All those in favor of House Bill 775, please say aye. If you oppose, please raise your hand in the panel. Bill passes unanimously. House Bill 7, there are no amendments, so no co-sponsors. House Bill 794, Delegate Aaron and Delegate Penny Melnick.
House Bill 794 was approved unanimously by the Appropriations Committee. They're the primary committee. HGO is secondary. The bill establishes an opioid restitution fund advisory council. The advisory council must report by November 1st of each year on its findings and recommendations regarding the allocations of money from the opioid restitution fund, consistent with authorized uses of the fund. There are amendments that require the opioid operational command center to staff the council. And the amendment also adds a representative of the Maryland Association of Counties to the advisory council. It did not go to subcommittee because HGO was secondary on the bill.
Right. Let me ask, how about I'll move approval of this bill? Is there a second?
Second.
Is there any discussion? All those in favor say aye. All those opposed, no. Please raise your hand in the panel. I see no hands in the panel. House Bill 794 passes this committee unanimously, and now we'll hand it back to the Appropriations Committee to take to the floor. House Bill 911, Lisa and Delegate Kelly.
This bill modifies the definition of doctoral degree in psychology to include a degree from a doctoral program that at the time the degree was awarded was offered through a school or university that was accredited by the American Psychological Association or the Canadian Psychological Association. The amendments specify the clinical experience that must be completed in addition to receiving the doctoral degree from an accredited school and receiving a postdoctoral respecialization certificate.
Delegate Kelly.
Thank you, Madam Chairman. So this is the bill you probably remember from the hearing that's going to allow people who already have a doctoral degree in psychology to respecialize in clinical services. Delegate Bagnall did a great job working with the board to get them on board. So everybody is on board with this. And with the amendments, it passed unanimously. Move the amendments.
Is there a second?
Second.
Is there discussion of the amendments? All those in favor say aye. All those opposed, no. Raise your hand. I see no hands in the panel. The amendments pass unanimously.
Bill is amended.
And
Second.
second.
Any discussion on the bill as amended? All those in favor say aye. All those opposed, no. The bill passes. Put your hands up in the panel. Bill passes
Co-sponsor.
unanimously. We'll move on to House Bill
Co-sponsor.
912.
Co-sponsor.
Oh, there is an amendment. Thank you for catching that before we moved on. Is there anyone who would not like to co-sponsor that bill? If you do not want to co-sponsor the bill, would you please raise your hand? Okay, the bill will be co-sponsored by all those members present. We will now move to House Bill 912. Lisa and Delegate Cullison.
This bill requires carriers, except for managed care organizations, to cover mental health or substance use disorder services provided by a non-participating provider at no greater cost to a covered person than if the services were provided by a participating provider under specified circumstances. The Consumer Education and Advocacy Program must provide public education to inform consumers of the process of requesting a referral for a non-participating provider. The amendments clarify the notice requirement that requires carriers to inform members of procedures for requesting a referral to a participating provider, non-participating provider, clarify that the coverage requirement applies when a member requests a referral, strikes language requiring the Healthcare Commission to establish a reimbursement formula, requires health occupations boards that regulate providers of mental health and substance use disorder providers to report to finance and HGO on progress the boards have made to develop a process for providing information on mental health and substance use disorder services to carriers for the purpose of carriers reaching out to the providers regarding participation in the carriers provider panels, and adds a 3-year sunset.
Delegate Cullison.
Thank you, Madam Chair. So this committee is acutely aware of the need for mental health providers in our state, and we hear about it regularly, and it's only intensifying. And part of that has to do with the scarcity of providers and then not only a scarcity of providers, but getting those providers into insurance networks. So what this bill is trying to address and clarifies how to do it is that when a member cannot find a provider within the panel or within the provider that is going to be covered by their insurance, they can let the insurance company know and see the provider that they do find who is outside of the network in order and have it paid for at the same rate they would as an in-network provider. This bill, besides giving that coverage to the consumer, it also gives the carriers the impetus to negotiate with more providers to try to get them into the networks. So this bill was artfully worked on with the carriers and the sponsor, and I would like to move the amendments.
Is there a second?
Second.
Any discussion of the amendments? All those in favor? Oh, Delegate Riley.
Thank you, Madam Chair. This is to Delegate Cullison. So I had on my notes that some of the carriers were still concerned because they thought that this would probably discourage the physicians to join a network. So did the amendments take care of that? And so they're okay.
Thank you for that question, Delegate, because you're right. That was the concern they raised in the hearings. What we did, or what they did and helped us do, is look where this existed in other states and the ultimate impact it had in other states. And what they found was they were, in some cases, able to get the providers into the network, these different providers. So while it was a balance between whether or not it would disincent or provide incentive for them to get in. So the
So
impact was not as great as they thought.
Pretty positive. Okay,
Right.
great. Thank you very much. Appreciate it. Thank you.
Good question, Delegate Riley. I'm glad that you could get an answer to give you some comfort to the decision that you're making, whatever that is. Any other discussion? Seeing none. I believe there is an amendment. So did we move and second the amendment?
Yes, ma'am, we did.
Thank you very much. All those in favor of the amendment, please say aye. All those opposed, please raise your hand in the panel. I see no hands. The amendment passes unanimously. Delegate Cullison, would you like to move the bill?
I'd like to move the bill as amended, please.
Is there a second?
Second.
Any discussion on the bill as amended? Other than thanks to the chair of the subcommittee? All those in favor say aye. All those opposed, no. Please raise your hand in the panel. I see no hands. The bill passes unanimously. There is an amendment.
Madam Chair,
Yes,
could we do a sponsor amendment, Madam
we
Chair?
could. I was just about to say, since there's an amendment, is there anybody who would like to not be a sponsor on this bill? Anyone? Everyone present who is a member will be a sponsor of this bill. House Bill 915, Aaron and Delegate Penny-Melnick.
House Bill 915 requires the Maryland Healthcare Commission to designate a patient safety center for the state by December 31st, 2025, and establishes a patient safety center fund to subsidize a portion of the costs of the center. For fiscal 2023 and each fiscal year thereafter, the governor must include in the annual budget bill an appropriation of $1 million for the fund. By October 1st of each year, the Maryland Healthcare Commission, in conjunction with the center, must report to specified committees of the General Assembly on the center's statewide activities and how the center's initiatives align with state designated priorities. There are no amendments.
Delegate Penny-Melnick.
Thank you, Chairman. Thank you, Aaron. The bill passed unanimous in the committee, and it actually is in the same posture as it is in the Senate where it passed. These patient safety centers were created by legislation in 2004. The Maryland Healthcare Commission designates these patient safety centers every 5 years. They're actually, the last designation will last until 2025. They're presently are funded with hospital money. They do work that is broad, not just hospitals. It actually benefits everyone in the state. And the way the bill now calls for it, it's funded through the general fund. And the Maryland Healthcare Commission wants it in this manner. They're very supportive. I move the bill.
Second.
Is there any discussion on the bill? Seeing none, all those in favor say aye. All those opposed, please raise your hand. House Bill 915 passes unanimously. House Bill 1034, Lisa.
House Bill 1034 renames the State Board of Examiners of Nursing Home Administrators to be the State Board of Long-Term Care Administrators and requires that an individual must be licensed by the board to practice as an assisted living manager in the state beginning October 1st, 2024. The amendments require OHCQ to notify the board if an assisted living program is appointed as a residence representative. Require assisted living managers employed by an assisted living program that is licensed for 4 or fewer beds to take a specified manager and training course by September 30th, 2024. Alters the composition of the board to include 5 nursing home administrators and 5 assisted living managers. Contains current language for individuals who fail to appear at hearings. Authorizes an alternate assisted living manager to act as interim assisted living manager under certain circumstances. Applies the current exemption for the assisted living manager training course requirement to certain licensure applicants. Grandfathers grandfathers individuals who have been employed as an assisted living manager at a facility with 5 or more beds as of September 30th, 2020, strikes inconsistent education and training requirements and continuing education requirements, lowers certain penalties, establishes a civil penalty for practicing as an assisted living manager without a license, except that it provides an exception if an individual is in violation of the provisions before September 30th, 2025. In that case, the individual will not be penalized, but will receive a written notice of the violation and have 60 days to comply with the licensure requirement. And lastly, the amendments establish a reporting requirement for the board.
Delegate Kelly.
Madam Chairman, you heard there's a lot of amendments on this bill. It did pass unanimously, as did the amendments. We are going to be the 16th state to license assisted living managers. It's an important thing to do. It's good for public safety. There's plenty of reasons to do it, and the stakeholders are all on board with the amendments in doing it this way. Move the amendments.
Second.
Is there any discussion on the amendments? I see Delegate Sample Hughes' hand raised.
Thank you, Madam Chair. I just wanted to get clarity because this is a great bill. What is the reporting requirements? How frequently are those done, or is it just an annual report that's supposed to happen?
So I believe they have an annual report that they're required to do already, but this will be in addition to that. By October 1st, 2023, they will submit a report on the status of the appointments of the living manager members to the board. They will study the number of personnel employed by the board to implement the assisted living manager licensure requirements. They'll study the ability of the board software platform to accept applicants for licensure as assisted living managers and issue the license. They will study the timeframe for informing and steps that will be taken to inform assisted living programs and assisted living managers of the license requirement, and then any other policies that the board anticipates adopting as related to this act.
Okay, thank you. I see it's very comprehensive. Thank you.
Delegate Peña-Melnick worked very hard to get everybody on board with this.
Thank you for your work.
Any other questions? I believe this was moved and
I think
seconded.
the amendments were moved and seconded.
Good. All those in favor of the amendments, please say aye. All those opposed, raise your hand in the panel. The amendment passes unanimously.
Move the bill as amended.
Second.
Thank you. Is there discussion on the bill as amended? All those in favor say aye. All those opposed, please raise your hand in the panel. House Bill 1034 passes unanimously. We have the opportunity to add a sponsor amendment. Are there people who want to do that on this bill? Okay. Are there a lot of people? Could you?
I do.
Okay. Is there anyone who doesn't want to be a sponsor of this bill? I see no hands, but I don't want to add anyone by accident, by mistake. Okay, everyone present will be a co-sponsor of this bill. Next, we will move, I don't know if 1082 is on your list or not, but I'm told the amendments are not ready. So we're going to hold this till our next voting session tomorrow. House Bill 1107, Lindsay.
This bill establishes a regulatory framework for the licensure of individuals who provide sign language interpretation services in the state. The State Board of Sign Language Interpreters is established in the Office of the Deaf and Hard of Hearing. Beginning January 1st, 2024, an individual must be licensed by the board before providing sign language interpretation services in the state. The Sign Language Interpreters Fund is established to collect associated revenues and pay for the board's costs. In fiscal 2024 only, the governor must appropriate $100,000 in general funds to the board. There are no amendments on this bill, and it was considered in Government Operations Subcommittee.
Delegate Rosenberg.
Thank you, Madam Chair. The hard work on this bill was done by the lead sponsor, Delegate Bagnall, in the interim, because as council just indicated, there were no amendments offered beginning January 1, 2024. An individual must be licensed by the board before providing sign language. And this would sunset through the Maryland Program Evaluation Act, July 1, 2032. Move favorable.
Is there a second? Hello? Thank you. Is there any discussion on this bill? All those in favor say aye. All those
Aye.
opposed, please raise your hand in the panel. I see no, oh, I see a hand. Delegate Riley votes no.
No, I was in discussion, sorry.
Oh, did you have some? Well, we're in the vote part now, Delegate Riley.
Okay.
And there's no amendment, so we're that ship has kind of sailed. Okay. I see no one voting against this bill. The bill passes unanimously. And I see that there is no amendment, so there will be no co-sponsors. House Bill 1208. Lisa.
As amended, this bill requires the State Board of Nursing to evaluate the state's nursing workforce by certification level, region, and type of workplace on an annual basis. The bill also establishes a licensed practical nurse and registered nurse preceptorship income tax credit and creates a stakeholder work group to study expanding the state apprenticeship programs to the healthcare workforce. The amendment strike language regarding clinical extern certificates, strike language requiring the board to create and implement a marketing plan, and strike language requiring the board to create and maintain a publicly accessible website for individuals seeking licensure or certification. The amendments require the board to adopt regulations establishing standards for online nursing assistant training programs and require the board to approve the use of nursing assistant training sites within 14 days after the program requests approval if the program has previously been approved by the board. The amendments also clarify that certain qualification requirements for certification apply to certification as a geriatric nursing assistant, clarify provisions allowing an individual to apply on-the-job experience toward the training hours for certification. That provision applies to applicants practicing as temporary nursing assistants. Specifies the preceptor income tax credit applies to advanced practice registered nurses rather than nurse practitioners. Requires the stakeholder work group to make recommendations on nomenclature to describe healthcare apprenticeship programs, and also requires the Department of Health to establish a work group to examine how the state can implement a loan repayment assistance program for nurses and other practitioners licensed by the Board of Nursing to incentivize practice in professional shortage areas and medically underserved areas of the state.
Delegate Kelly.
Madam Chairman, and thank you, Lisa, for reading all of those amendments. The important thing to know is that this bill is attempting to address all the low-hanging fruit we can in terms of barriers to getting certified nursing assistants and nurses working in the state of Maryland. So as amended, the bill still has a preceptorship tax credit because finding preceptors has been a real challenge for us. It requires a solution for the folks who've been working as temporary nursing assistants under COVID rules so that we can keep them in the workforce. It looks at ways that we can use apprenticeship. It's a work group to look at ways to use apprenticeship in healthcare and to look for a long-term solution for the nursing loan repayment program. So, that's what remains in the bill. The parts that the Board of Nursing couldn't do without costing a lot of money have been struck from the bill. So move the amendments.
Second.
Is there discussion on the amendments? All those in favor say aye. All those opposed, no. Please raise your hand. Seeing no one saying no, the amendments pass unanimously.
The bill is amended.
Second.
Thank you. Is there discussion on the bill as amended? All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. Is there anyone who would like to be a co-sponsor?
Would.
Is there anyone who would not like to be a co-sponsor? And Delegate Saab, if you're talking to me, you're muted. If you're not talking to me, it's fine. Okay, I don't see anyone who does not want to be a co-sponsor. So we will all be co-sponsors on this bill, all people present and voting on this bill. Okay, 2 bills left. House Bill 1222. Aaron?
This bill establishes the Baltimore City Behavioral Health Crisis Incident Review Team in Baltimore City to review behavioral health crisis incidents involving law enforcement in Baltimore City, identify root causes and patterns within and across public systems that result in behavioral health crises involving law enforcement, provide recommendations based on identified factors that contribute to behavioral health crises involving law enforcement among entities involved in the behavioral health and law enforcement systems, and assist in the implementation of procedural, logistical, and clinical changes to minimize the need for law enforcement involvement in behavioral health crises. The bill also establishes provisions governing review team membership, access to and disclosure of specified information, and in meetings. This bill was in the Public Health and Minority Health Disparities Subcommittee.
Delegate Peña-Melnick.
Oh, I'm sorry, there is one amendment that would, in the membership on the review team, it strikes the specific reference to the Behavioral Health System Baltimore and replaces that with the local Behavioral Health Authority for Baltimore City.
Thank you. Delegate Peña-Melnick.
Thank you, Chairman, and thank you, Aaron. We did get the letter from the city, and they did testify that they need this in order to be able to do it. They're not able to do it on their own. We did discuss it. The vote was unanimous. I move the amendment.
Second.
Is there discussion on the amendments? All those in favor say aye. All those opposed, no. The ayes have it. The amendment passes unanimously.
I move the bill as amended, Chairman.
Second.
Is there discussion on the bill as amended? All those in favor say aye. All those opposed, no. Please raise your hands. I see no hands in the panel. The bill passes unanimously.
Madam Speaker, can you mute that? Speaker,
I don't know.
Madam
who
Chairman, I'm
that
voting
was.
opposed.
What? Okay, I see Delegate Kipke's hand up.
I'm voting against.
Oh.
We had audio visual technical difficulties here. I
We will
apologize.
correct, that's no problem. We will correct the vote. If there were problems, we want to get the vote right. So it's not unanimous. We have some people voting in opposition to this bill. We'll start with Delegate Kipke, Delegate Riley, Delegate Saab, Delegate Morgan, Delegate Shalega. Is that all? It's all I see. Okay, so there are 5 people voting against this local bill. Okay, did you get that, staff? Which I think means Richard, maybe?
Yes, ma'am. I got them.
Okay, great. House Bill 1343, Delegate Ludke. I'm sorry, Lindsay.
This bill requires specified state contractors on major state contracts to file statements with the State Board of Elections regarding any donations to an advocacy organization that pays for public communications relating to a procurement contract or public-private partnership involving cumulative consideration of at least $1 million in which the state contractor has a financial interest. There were amendments that were sent around separate to the packet that were adopted in the Environment and Transportation Committee. We are secondary on this bill. The amendments move the provisions of the bill from the general provisions article ethics law to a new subtitle in state finance and procurement. They apply the disclosure of donations requirements to public-private partnerships and alter the definition of major state project, which is a single procurement contract with a single unit involving cumulative consideration of at least $1 million to also include options, renewals, and other extensions on the contract.
Delegate, oh, it's no delegate. We're second on this bill. This did not go to subcommittee. I will move House Bill the amendment. Do we need to move the amendments or are they already on there when we get it? So we just are voting on the bill as they amended it. Lindsay?
I'm not actually sure, but I don't think it hurts to vote on the amendments as well.
Okay. were you gonna make a suggestion, Delegate Kipke, or? did
After you vote on the amendments, Madam Chairman, I'd like to offer an amendment.
Okay, we'll vote on the amendments first. All those in favor of the oh, I'm sorry, I'm going to move the amendments. Is there a second?
Second.
Is there any discussion on the amendment? All those in favor, say aye. All those opposed, no. Please raise your hand. I see no hands. The amendment passes unanimously. And we'll now move to Delegate Kipke.
Thank you, Madam Chairman. I'd like to offer a verbal amendment to add public and private sector unions to the provisions of, to the requirements of this bill. I move the amendment.
Is there a second?
Second.
Okay, I am going to say that since this bill didn't go to subcommittee, and since I don't feel as comfortable dealing with an amendment to a bill that we are not primary on, I would encourage this committee to vote against this amendment at this time. I'm not trying to prejudice the amendment. I just don't feel comfortable that our committee has the depth with this not going to the subcommittee to defend it adequately or to support it adequately. So with that, I will suggest that we vote against the amendment, but we will expect probably to see it again somewhere. Delegate Hill.
I'm just wondering, Madam Chair, if there's time, if it would be appropriate to just refer it back to make sure that we can amend it and then to consider the amendment in subcommittee.
This is a time when there isn't time for most of those things, Delegate Hill, and I appreciate you qualifying it with that. This is the Wednesday before crossover. So we're going to be respectful of the committee so that they can get it through. Delegate Cullison.
Thank you, Madam Chair. I think this question might be for Lindsay. Do you have any knowledge about whether or not this amendment was offered in ENT?
I do not know that. I don't, sorry.
Okay, thank you.
Okay, is there any further discussion on this verbal amendment? All those in favor of the verbal amendment, please say aye. All those, let's wait a minute. Let me think about that. Yeah. All those in favor of the verbal amendment, please raise your hand. Thank you for being ahead of me on this. All those opposed to the verbal amendment, please say no. We don't usually do it this way.
No.
Count hands because they're the smaller number and that makes it easier, which is why we do it the other way most of the time. Okay, the amendment fails, but voting for the amendment are Delegate Saab, Delegate Chisholm, Delegate Shalega, Delegate Riley, Delegate Morgan, and Delegate Kipke. Is there anyone that I missed? Okay, you'll be reported in that way on that amendment. That said, I will move the bill as the committee amended it, which does not include the verbal amendment. Is there a second?
Second.
Is there discussion? All those in favor of the bill? Oh, Delegate Kipke, your hand is up. Are you voting? Is that your vote?
I just want to say something really quickly, Madam Chairman. Thank you for acknowledging me. I would vote for this bill if it included all parties that do this practice. I believe in transparency in this arena. I think it's important for people to know who are behind the dollars funding PR campaigns around certain projects. But I just think if it's good for the goose, it's good for the gander, and all folks that do this should be on the record. Thank you. And for those reasons, I'll be opposing the bill. Thank you.
Thank you, Delegate Kipke. Delegate Saab, then Delegate Shalega.
No, my hand is was my vote for on the amendment.
Delegate Shalega. Delegate Shalega, your hand is up. Is that to say something or just to vote?
I couldn't, my button wouldn't unmute. So sorry.
It's okay.
Yes, I just want to point out that Delegate Kipke is correct. There was a movement, and you may remember it. It was called Take a Hike, Mike. And it was a public union that came out against Mike Miller. And so, you know, these things do occur, and we should capture everybody and not pick winners and losers. So I agree with Delegate Kipke. I'm sorry we couldn't take that amendment.
Thank you, Delegate Shaleka. We will certainly get the message back to ENT. Any other comments before we vote on this? Okay, I think we moved and seconded the bill as amended. So all those in favor of the bill with the amendment that ENT put on it, please say aye. And all those opposed to the bill, please raise your hands. I see Delegate Riley was the first to hit that button. Delegate Kipke, Delegate Chisholm, Delegate Morgan, Delegate Saab, and Delegate Shaleka. So we have, do you have that vote? I think that is Richard.
Yes, ma'am. Got them all.
Excellent, thank you. That is the last bill
Thank you, Jesus.
of this voting session. Be prepared for another one tomorrow and another one on Friday because it's crossover week. I apologize that we are not doing too well on notice and that the amendments are a little bit messy. In some cases, there were amendments that were not relevant to bills tonight. We're doing our very best to be accurate and get information to people as quickly as we can get it together, but there are a lot of bills and we're trying very hard to pass all of your bills that we're able to. And for that reason, please try to bear with us. And as you know, we're a little handicapped with staff at this time as well. I see some hands still up. Are they people who wish to say something? Delegate Young, followed by Delegate Morgan. Delegate Young.
Yes, thank you, Madam Chair. My bill, House Bill 293, the 998 suicide bill, was on the agenda an hour ago, and then it suddenly disappeared. I don't think there's a problem with it because I didn't get a call or a contact. I think it was just an oversight. So given your comments about House Bill 1343 and where we are, can we put that back on the agenda?
Delegate Young, I just learned from staff that there was something that went wrong. I honestly never saw it on my version of the agenda, but apparently something went wrong. And as I said, our staff is brand new. One of them has been with us for 3 weeks, the other for 3 months. So not everything is going perfectly. And I apologize for that. No, we can't put it on the agenda tonight, but we will put it on the agenda tomorrow and we will get it through. Okay? That's the best I can do. Delegate Morgan.
Sorry, Madam Chair. I apologize to the committee. I was a little late signing on. Can I be recorded in the red on the first bill? I missed that vote. In the House Bill 6.
House Bill 6. Richard, are you back at your desk? He was in here explaining to me what happened to Delegate Young's bill. So I don't know if he's at his desk. Okay, so have you put Delegate Morgan in green, correct?
Thumbs up. Yeah, thank you, Richard.
Got it.
Thank you. We try to be patient with people when we can.
Thank you, Madam Chair,
Delegate,
committee.
you're welcome. Delegate Kelly.
Thank you, Madam Chairman. Just want for the benefit of the committee to remind them that Health Occupations is meeting immediately after the first floor session tomorrow. I know insurance needs to squeeze in a meeting, so make sure to go straight from the floor session to Health Occupations and we will get done with what I hope is our last agenda.
I would expect that the floor session tomorrow will be roughly equivalent to the floor session today, that it will not be quick. I have no knowledge of that. It's just an expectation of how things are this week. So, bring a bottle of water or something.
And just to be clear, we'll do it 15 minutes after floor like we have been, so everybody can get to the restroom and, do stretch a little, but 15 minutes after floor we'll start.
Okay, that will be Health Ocs 15 minutes after session tomorrow. I'm going to go through all of the people who have their hands up, so please be patient with us. Madam Vice Chair.
Thank you, Chairman. The Health and Government, the Public Health Subcommittee will be meeting tomorrow. So if you could just please pay attention to your email, I will really appreciate it, and we'll let you know the time. Thank you so much.
Thank you, Delegate Penny-Melnick. Delegate Cullison.
Thank you, Madam Chair. My message is exactly the same as the Vice Chair's, only with respect to the Insurance and Pharmaceutical Subcommittee. We are going to try to squeeze in a subcommittee meeting between the two floor sessions tomorrow, and we'll do it with respect to the other committees. So please watch your emails. Thank you.
Okay, Delegate Rosenberg.
Same message. Stay tuned. We expect to begin our discussion in subcommittee of the cybersecurity bills tomorrow.
Okay. Delegate Carr.
Thank you, Madam Chair. I apologize that I signed on late. I had to pick up my son. May I be recorded in the green on House Bill 6?
Richard, you got that?
And-
Richard?
Got it.
And Richard,
Thank
you
you
got
very
me in the red on that, right?
Gotcha now.
Okay, thank you.
Okay, is everything correct? I hope it's correct. We're doing our best here. As we said, there's a lot of stuff going on for everybody right now. With that, I would like to thank the subcommittee chairs and their members. I have to tell you, this is the most amazing committee in the General Assembly because the work really does get done in subcommittees. And I know all of you contribute. I know all of you work hard in your subcommittees, and that's what makes this committee process really work here. And I am most grateful to every one of you for the help that you give. Even when you disagree with what's going on, your insight makes the bills better. Sometimes we use the amendments, sometimes they don't get adopted, but it's important that we discuss things thoroughly before we believe them, that we make sure they're as good as they can be. So to everyone, try to take a deep breath, as Mike Bush used to say. This is a very hard week. It's Wednesday, we have Thursday, Friday, Saturday, and everything will be better on Monday, I promise. So with that, have a good evening, and I will see you tomorrow.